Have you ever thought about how amazing our lungs are? They work silently day and night, taking in air and giving us life. Every breath we take gives our bodies the oxygen they need to function. We use this oxygen for everything, from running and playing to thinking and even sleeping. Breathing is something we usually don't have to think about. It just happens. But what if our lungs couldn't do their job properly? What if something prevented them from delivering enough oxygen to our bodies? This is where diseases like cryptogenic organizing pneumonia, or COP, come in. COP is a rare lung disease that can make breathing difficult and affect our overall health. Understanding COP is the first step towards recognizing its symptoms and seeking timely treatment. Remember, breathing freely is essential for a healthy and active life. Just like we protect our skin from the sun or our teeth from cavities, we need to understand and care for our lungs too. By learning about conditions like COP, we can take better care of ourselves and those around us. Imagine tiny air sacs in our lungs like balloons that help us breathe. Now imagine these balloons getting inflamed and filled with something else instead of air. That's somewhat similar to what happens in COP. COP is a type of lung disease that causes inflammation and blockage in these tiny air sacs, called alveoli. This inflammation makes it hard for the lungs to exchange oxygen properly, making it difficult to breathe. The term cryptogenic means we don't know the exact cause of this inflammation. COP is different from other lung diseases because it doesn't involve infections or cancer. It's like the lungs having an allergic reaction, but we don't know what the allergen is. This makes diagnosing COP a bit tricky, like solving a mystery. While the exact cause of COP is unknown, researchers believe it might be triggered by things like exposure to certain chemicals, viruses, or even some medications. However, more research is needed to understand this complex condition fully. Diagnosing COP is like putting together a puzzle. Doctors have to look at different pieces of information to get the complete picture. They will start by asking about your medical history and symptoms. This will be followed by a physical examination, where the doctor will listen to your lungs and check your overall health. To confirm the diagnosis, doctors use a variety of tests. One of the most important is a chest X-ray, which can show characteristic patterns of inflammation in the lungs. However, sometimes a chest X-ray is not enough. In such cases, doctors may recommend a CT scan for a more detailed look at the lungs or a lung biopsy. A lung biopsy involves taking a small sample of lung tissue and examining it under a microscope. This helps doctors confirm the presence of COP and rule out other lung conditions. Early diagnosis is crucial for COP because it allows for timely treatment and better outcomes. The sooner treatment begins, the better the chances of preventing lung damage and improving quality of life. Recognizing the signs of COP is crucial for early diagnosis and treatment. The most common symptom is shortness of breath, which can occur gradually or suddenly. It's important to note that shortness of breath can be caused by a variety of factors, so it's essential to pay attention to other accompanying symptoms. Another common symptom is a dry cough, which may or may not produce phlegm. Some people with COP also experience fatigue, especially after physical activity, and unexplained weight loss. Other less common symptoms include chest pain, muscle aches, and a low-grade fever. It's important to remember that these symptoms can also be present in other respiratory illnesses, making it challenging to self-diagnose. If you experience any of these symptoms, especially if they persist or worsen, it's crucial to consult a healthcare professional for proper diagnosis and treatment. Early detection and treatment are key to managing COP effectively and preventing long-term complications. Don't hesitate to seek medical attention if you're experiencing unusual respiratory symptoms. COP is considered a rare disease, meaning it affects a small percentage of the population. While exact numbers are difficult to pinpoint, studies suggest that COP affects about 1 to 4 people per 100,000 each year. To put that into perspective, imagine a large sports stadium. Only a handful of people in that entire stadium might have COP. While COP can affect anyone, it's more common in adults between the ages of 40 and 60. It's also slightly more prevalent in women than men. However, the reasons for this gender difference are still unclear and require further research. COP's rarity is both a challenge and an opportunity. It's a challenge because it can be difficult to diagnose and treat a disease that doctors don't see very often. However, it's also an opportunity because researchers are constantly working to learn more about COP, its causes, and potential treatments. Despite its rarity, it's important to be aware of COP. especially if you or someone you know experiences persistent respiratory symptoms. Early diagnosis and treatment can make a significant difference in managing the condition and improving quality of life. Like, share, comment, and subscribe.